Welcome, Iliana and Lissa. It is so wonderful to speak with you today. I've been looking forward to this for quite some time. But for those who may not know of you or your work, could you introduce yourself? Let's start with Lissa.
Hi, thanks, Susan. I'm Lissa Pressfield. I am the Chief of Child and Adolescent Health at the California Department of Public Health. I work in the Maternal, Child, and Adolescent Health Division. I'm very honored and excited to be here today. So thank you so much for inviting me.
Thank you. Iliana?
Hi, I'm Iliana White. I serve as the Senior Program Manager in Adolescent Health at AMCHIP, which is the Association of Maternal and Child Health Programs, and I am excited to be part of this opportunity to speak with you today.
Lissa, you have been very closely involved with this as a grantee. So I'm wondering, from your perspective, what is the contribution of this supplement and why does it matter for the field and the work you do in California?
In terms of the journal supplement, I worked with several of my colleagues at the Department of Public Health, and we wrote an article from the perspective of a state agency. We wrote about a program development process that we went through starting at the beginning of the Pregnancy Assistance Fund grant project back in 2010. And we really wanted to put forward a perspective of the role that state agencies can have in supporting expectant and parenting youth and the role that state agencies can have in program development. We had a long-standing program that supports expectant and parenting youth in California that started in the 80s. And we wanted to standardize that program, and we wanted to really integrate compelling theory and new science. We wanted to integrate the voice of case managers, of youth, and also work with experts, our academic partners at the University of California, San Francisco, and other partners to really learn from the implementation that had been happening in the state, and then also from kind of new research specifically around how to build resilience and integrate positive youth development to support expectant parenting youth with really a strength-based approach that could meet their diverse needs and kind of the unique needs that we see in this population.
And that there are a few things that you've touched on there, Lissa, that I see throughout many articles in the journal. One, the incredible need for partnerships, a lack of evidence to really guide programs in what to do. And your state was part of an effort to do so on a national scale. And there are articles in the journal that reflect Mathematica's independent evaluation of the program. As you were kind of building it, we were observing and learning a lot from you. Iliana, how about from where you stand in the national organization, kind of what perspectives do you see represented in this supplement, and why does it matter for the field and the work that you do at AMCHIP?
Sure. So we have to acknowledge that there are still many youth and young adults and older adolescents that become parents every year, whether it's for the first time or it's a repeat birth. And it's important that we support these young people in their parenting journey so that they feel equipped to raise their families, but also pursue their personal goals. And the Pregnancy Assistance Fund emphasizes multifaceted frameworks and partnerships that are designed to meet the needs of these expectant and parenting teens who they themselves are still developing as adolescents and young adults, whether it's physically, cognitively, socially, professionally, as well as developing in their role as caregivers to their children. And it's important to understand and be cognizant of the developmental needs for these multiple roles and fully factor them into programming components intended for Pregnancy Assistance Fund participants. Another perspective that's reflected in the supplement included recruiting young fathers to participate and addressing their unique needs meaningfully. And we can't emphasize that enough, that involved fatherhood is linked to better outcomes on nearly every measure of child well-being. And then along with mother and motherly figures, fathers provide kids with a broader diversity of social experiences. So these were a variety of perspectives that were featured that, at a national organization, we can look at the diversity, but also look at what's our role in building the capacity of the different sectors represented under maternal and child health to meet the needs of these expectant and parenting teens.
We know that adolescence is developmentally a very important stage of life. Young people are learning about intimacy, they're learning and developing their own identity, and they're building skills that will support them and help them transition into adulthood. And they're also learning to be a parent, which Iliana pointed out as well. We know that young people are very busy. They're often, especially expectant parenting youth, who are often trying to balance parenting with school or jobs or other commitments with family and friends. The other thing I think is important to point out, and something that we know, is that in areas where there are high adolescent birth rates, there are also often structural and social challenges that communities face that impact these young people, such as poverty, food insecurity, housing instability. Sometimes there are limited educational and job opportunities or limited access to quality health care. So we see with our program and where we are serving expectant parenting youth that there often are challenges with meeting basic needs for themselves and their child or children. We also see the uniqueness of this population and that they have a tremendous amount and capacity and ability to be resilient through these very difficult situations.
A colleague of mine the other day said, we can't be afraid to fail fast. So as you implement programming, and I know that, Lissa, this is an approach that you all took when you developed and piloted in California, was you put a learning culture into place where you are failing fast, recognizing it, and then tweaking and moving on. I thought that was just a great lesson to kind of put in the forefront of your head as you kind of begin to put something on the ground.
And I think also, we learned a lot from trying to balance structure and a program model that could be replicated with this idea of adaptation and flexibility, and empowering the program staff on the ground to use their judgment and their skills to meet the needs of their clients. And I think that is a real challenge in thinking about how do we replicate and evaluate and scale up standardized evidence-based models while still providing enough flexibility and empowering the folks that are on the ground and giving them enough support, both in, as Iliana mentioned, in terms of training and technical support, guidance, tools, kind of figuring out what that looks like to help promote successful implementation of these programs.
So I want to thank you, Susan, and your staff for inviting me to have this opportunity to discuss the importance of this programming, not just its components, but also, what's been generated over the past 10 years. And I look forward to working, taking the work back with me to work with our national partners and our state counterparts to ensure that, components of these lessons learned are still embedded, they're enduring, even though the funding may have ended. And there's a lot of great examples out there that we can pull from and we can amplify, especially California, and making sure that, the lessons learned, the services, the ideas, the innovation, they're disseminated to other communities across the country. So that way the work continues. And so that we're able to embrace and support these young parents and their families, both as adolescents and young people, and also as caregivers. So I look forward to what's next for this population.
Well, thanks so very much to Lissa and Iliana for their time today. They represent both the perspective of an entire state grantee implementing a program statewide, and then Iliana brings kind of the national perspective. Now we're going to take it a little more local. They both talked about how there's no one size fits all approach and the need for involvement from young fathers as well. And as we heard from Amy and Mosumi earlier, the PATH program has really made strides to increase the number of young fathers being served. So with that in mind, our next and final guests are Sheldon Smith of the Dovetail Project in Chicago and Matt Stagner, a colleague of mine here at Mathematica, and we've worked on this evaluation together over the past 7 years.